Hey guys, welcome back to Closely Prescribed. I'm Robert,
Amelia.
I'm Micah.
and today we're going to talk about coronavirus and the effects it has on kids. Coronavirus, it has caused this pandemic, and it primarily affects adults. But one thing we do know that kids can get it too, and they can pass it as well. So what are the complications that people have seen when kids get the coronavirus? One of them is Kawasaki Disease. And that is a disease that basically takes your immune system and it starts to attack your blood vessels. And the question is, why would that be a problem? And I think the big problem with that is it can cause other type of complications such as myocarditis. It can have other issues such as lymphadenopathy. It can have other type of serious issues that you may not know is happening because you see it with, I think it starts with a fever, and then goes to a rash, and then proceeds further.
Strawberry tongue.
Yeah, strawberry tongue. That's kind of weird.
Yeah.
Have you guys seen that before?
Yeah. You know, we see the pictures, but now that we're going into rotations, I feel like it's just going to be a whole new world of translating what we've seen in pictures and what we know to be standard with reality. So I feel like the pictures probably do it no justice. But I know in addition to strawberry tongue, there's swelling in their hands and feet. Mm-hmm. Like you said, lymphadenopathy and other complications like multi-system inflammatory disease in children where there's even more swelling in their heart and their brain. So those are the severe complications we know about in children. But I think in general, research has shown that usually children are going to have a more mild form of the disease. Where, you know, there might be a fever, low-grade fever, some fatigue, cough, and, you know, that would be ideal. But unfortunately, there still are Kawasaki and other severe complications that we see in children.
Right. And something I read was if you do have Kawasaki and you think that the child is doing better, you might have coagulopathy issues and you might get thrombosis. And that could cause other problems in your cardiovascular system.
Right.
So even if you see that your child is getting better from these initial symptoms, it is important to take your child to see a physician.
Right.
But I mean, like all of that is like textbook medical side. Like, what is it? How do you feel about? Let's say you have a child. How would you feel about letting your child go back to school? And you know these complications. You've seen the scientific literature about this.
Right.
Like, how do you feel about that?
Yeah, so just starting early on with COVID, obviously it was a disease that we knew very little about in humans. Like you said, it was a zoonotic disease that, you know, we learned about for a millisecond at the beginning of medical school. But when it started to manifest in humans, just as a parent, your initial reaction is to protect your child, protect yourself the best way that you can. So the way the school system, at least in Nashville, was set up, you had to make a binding decision. Is your child gonna be virtual or in person for a whole semester? And then, you know, this semester, the binding decision was made in December for the rest of the semester. So to protect my child the best way that I knew how, I decided for her to be virtual for both semesters. So moving forward, we know that there are vaccine trials underway for children, but we don't know what that might mean for months down the road, a year or more down the road. So moving forward, I don't necessarily know what that'll look like for, you know, after those summer months, because we know America has not been the greatest with following the necessary safety precautions, but I'm thankful that with this new administration, vaccinations are becoming much more widespread, and hopefully, you know, after several months, we might get closer to herd immunity. I know it seems like a far-fetched idea, but, you know, we're able to be here again without masks because we've been fortunate to have vaccinations.
Yeah.
So I just knowing that I have that safety moving forward to be around my child, it helps but the fact that there still aren't necessarily all necessary safeguards in place for children is still concerning.
So we know that people who have gotten these, sequelae illnesses, these are kids, they're about like 10% of those who actually get the coronavirus infection. So that means 90% of children who get it are likely going to be fine. What is that statistic? Like, that statistic to me sounds great, but again, I don't have a child, so I don't know if that 10% is like, oh, it's fine, my kid's going to be okay, or you could say that 10% is way too much. I mean, how does that feel to you?
Yeah, I think in medicine, 10% is still a high number.
Okay.
When you think about infection for adults or children, whether it be a sequelae or serious complications. And I think that there's still so little known. They know maybe a sequelae from a year, right? Mm-hmm. But what about 10 years from now? What about 20 years from now? What does that really mean? And for me, that's still too much of a risk.
I see that. I think you've had some experience in your family with like Kawasaki disease, like from your past history with your family, right?
Yeah, so back in the 90s during the Yugoslavian Civil War, my cousin actually had Kawasaki's and they needed a vaccine to give to him. So they had to, I guess, go around the corners and go to Germany and get this vaccine and get it shipped off to Serbia where my cousin was. So it was super expensive, but we got it out there. So he's alive now. He's 27, 28 years old with a kid on the way and a kid he already has. So I think it's crazy how medicine works and how just the vaccine can help you so much. I'm not sure exactly how it all worked, but it was before I was born, but from the stories it seems pretty heroic.
Wow, that's an interesting story. I mean, we are kind of like learning more about these diseases because they're autoimmune, right? Mm-hmm. And we don't really know where they come from. And we know that viruses definitely affect children. You know, children get a lot of viruses and they pass them and they get the immune response from them. But these particular autoimmune responses to these viral infections are kind of new to us. And we're learning a little bit more about it. And us as physicians, we're learning about the details about how they present, and then you have researchers who are trying to figure out like what causes them. So we're still kind of like on the edge of figuring this out. But I think it's interesting to hear like both of your perspectives because these diseases don't just happen in a textbook, like they affect people's lives, right? So whether they are in a different country or whether you're talking about your own child, I think those are really important stories to be had.
Yeah, I agree. I think it's an ever-evolving thing. I think we're going to find out more about these viruses and these autoimmune issues, and hopefully soon we'll have like cures for these. You know, there's so many autoimmune diseases that affect millions of people in the U.S. and hundreds of millions around the world. I think that we're going to continue having new technologies that are going to be able to fight these and ensure that our bodies don't kill ourselves.
And that's what we're here for, right? We're the next generation of medicine. So, what footprint will we leave in medicine to really begin to target diseases that we know exist, but there might not be answers to yet?
Right. Like, so the one thing that we do have right now, or the few answers we have to fight immune diseases are steroids, right? You can calm those immune responses down, tell those macrophages to just chill out for a while because they're wreaking a lot of havoc in our body. But we need something better. Yeah. We can't just like wait for you to get sick, wait for you to get that strawberry tongue and be like, okay, let's try to treat this. Because just because you are cured from a disease doesn't mean your body is back to, 100% from where it started. So I think it's very imperative to at least continue studying this, but also hearing the stories of people and how it affects our lives to show this is important. We shouldn't just sleep on it. Yeah. So,
and especially with all the side effects of steroid use for long term, it's not really good for you.
Yeah. What side effects? You
get weight gain. You can possibly get what's that thing called?
Take your time. It's fine.
The humpback and Cushing's disease, and so that's not a favorable outcome of long-term steroid use, and you have a big issue with weight loss after you stop your steroid use. So it's very difficult for specifically women with weight loss after long-term steroid use.
I think women would actually think that's very important about your weight gain for the type of drugs you're using. So that's cool. All right. Well, you guys have anything else to add about like coronavirus and how it affects kids or anything?
Yeah, I would definitely say continue to practice all the safety precautions. Keep yourself and your family safe. Hand washing, social distancing.
Get vaccinated.
Yeah. Have your children wear masks. I know now even this mask journey has been kind of comical in a cynical way. But going from saying no mask to one mask, now 2 masks. So I know my daughter and our families wear 2 masks. So continue to stay safe and do everything that you can to keep your family safe.
Yeah. All right. I think that's pretty good.
Thanks.
All right, guys. Well, that's our video for today. Hope you guys learned a few things about different diseases that are coming from an infection with the current coronavirus. And tell a friend. Please leave a comment, subscribe, and come back next time for another episode of Closely Prescribed.
Thank you. Have a good one.